Have you ever wondered what happens when a blood clot forms in the deep veins of your body? This isn't just a hypothetical question, it's a reality for many people who experience a medical condition known as deep vein thrombosis, or DVT. DVT is characterized by the formation of blood clots in the deep veins, typically in the legs. These aren't your everyday bruises from a bump or fall. These clots can cause severe complications by blocking the normal flow of blood. Imagine a highway bustling with cars, suddenly blocked by a massive obstacle. The traffic comes to a standstill and the repercussions are felt far and wide. In the body, this traffic jam can lead to painful swelling and, in severe cases, even a life-threatening condition called pulmonary embolism if the clot dislodges and travels to the lungs. But what causes DVT? Who is most at risk? Let's delve into the risk factors of DVT. Several factors can increase your risk of developing deep vein thrombosis. First, let's talk about immobility. Extended periods of inactivity, like during a long-haul flight or bed rest following surgery, can slow your blood flow and heighten the risk of clot formation. Next, we have surgery or trauma. Certain types of operations or injuries can damage your blood vessels, making them more prone to clotting. Thirdly, various medical conditions can amplify your chances of developing DVT. This includes diseases like cancer, heart disease, and inflammatory disorders, all of which can alter your body's normal clotting mechanism. Finally, genetic factors also play a role. Some individuals inherit a predisposition to blood clotting disorders, increasing their likelihood of developing DVT. Understanding these risk factors is crucial in managing your health and preventing DVT. Now that you know the risk factors, let's move on to the symptoms of DVT. Identifying the symptoms of DVT can be a challenge as they are not always noticeable. However, when they do appear, they can manifest as swelling, pain, or tenderness in the affected leg. Warmth over the area of the clot is another possible sign, as is red or discolored skin. These symptoms can sometimes be mistaken for other conditions, which is why it's crucial to seek medical attention if you're experiencing them. When it comes to diagnosing DVT, medical professionals often turn to imaging tests. Ultrasound in particular is commonly used because it can provide a clear image of your veins and potentially reveal a blood clot. In addition to this, a D-dimer blood test might be conducted. This test measures a substance that's released when a clot breaks up, and high levels can suggest the presence of a blood clot. As we understand the symptoms and diagnostic measures, let's explore the treatment options for DVT. Treating DVT involves preventing the clot from getting larger and reducing the risk of complications. One way this is accomplished is through the use of anticoagulant medications, often referred to as blood thinners. These medications work by decreasing the blood's ability to clot, thereby preventing the clot from growing and reducing the risk of a pulmonary embolism. In some instances, other interventions may be considered, such as thrombolytic therapy, which uses medications to dissolve the clot, or the placement of a filter in the vena cava, the body's largest vein, to catch any dislodged clots. Prevention is equally important. This can include the use of compression stockings, which help increase circulation and prevent blood from pooling and clotting. Medications may also be prescribed as a preventive measure, particularly for those at high risk. Lifestyle changes can also play a crucial role in prevention. Regular physical activity, particularly during long periods of immobility, is key. Remember, staying active, especially during long periods of immobility, is important in preventing DVT. Deep vein thrombosis is a serious condition that requires immediate medical attention. As we've explored, it's a condition marked by blood clot formation in the deep veins, often occurring in the legs. Known risk factors include immobility, certain surgeries or trauma, medical conditions like cancer or heart disease, and genetic predisposition. Symptoms can range from subtle to noticeable, with swelling, pain, warmth, and skin discoloration being common signs. Diagnosis is typically through imaging tests and D-dimer blood tests. Treatment usually involves anticoagulant medications, and in some instances, more direct interventions may be necessary. Prevention is key, particularly for those at high risk. Measures like using compression stockings, staying active, and making lifestyle adjustments can help. The importance of awareness cannot be overstated, especially if you have risk factors. Stay informed, stay healthy, and always consult your healthcare provider if you suspect DVT.